Emergency medical response provides a comprehensive introduction to the work of emergency medical responders and their place within the broader EMS system. The course begins with the structure of EMS, levels of training, and the specific roles, responsibilities, and professional expectations of an EMR in pre-hospital care. Key units cover ethical principles, consent and confidentiality, medical legal responsibilities, and the importance of accurate documentation and patient care reports. Students study communication skills for EMS teams, including clear handoffs, use of medical terminology, and building positive relationships with patients under stress. A major portion of the course explores workplace safety, infection control, universal precautions, and exposure control plans, including sharp safety and pathogen transmission. Content on anatomy and physiology introduces the major body systems and anatomical terminology needed to understand illness and injury patterns. The course then focuses on patient assessment, beginning with scene size up and primary assessment, continuing through vital signs, ongoing reassessment, and the ABSITI method for identifying life-threatening conditions. Basic life support skills are developed through lessons on airway management, manual and mechanical airway techniques, CPR, AED operations, artificial ventilation, and supplemental oxygen therapy that align with current clinical guidelines. Students learn to recognize and manage soft tissue injuries, external and internal bleeding, types of shock, and respiratory failure, as well as common medical emergencies such as diabetic events, seizures, stroke, chest pain, and respiratory distress. Environmental and injury-related topics include hypothermia and heat-related illnesses, burns, eye injuries, poisoning, and animal and insect bites, with emphasis on scene safety and early intervention. Musculoskeletal care is addressed through identification of fractures, dislocations, sprains, and strains, followed by immobilization principles, use of commercial splints, improvised splinting, and post-immobilization monitoring. Specialized trauma care lessons guide students through assessment and management of head, neck, spinal, and abdominal trauma, including spinal motion restriction, cervical collars, and securing patients to spine boards. Age-specific and special population content examines pediatric and geriatric assessment, chronic conditions, polypharmacy, mental health crises, disabilities, and recognition of abuse and neglect in vulnerable patients. Students also explore hazardous materials awareness, personal protective equipment for hazmat scenes, decontamination procedures, and responder and patient safety during contamination events. The curriculum connects EMR practice to larger emergency systems through coverage of the incident command system, triage during mass casualty incidents, disaster and terrorism response, and the psychological impact these events have on responders. Additional modules address search and rescue operations, water rescue, extrication from dangerous environments, and the EMR's role in childbirth complications, and immediate postpartum care. Throughout the course, scenario-based learning and practical applications reinforce emergency medication concepts, including indications, routes, dosage calculations, safety checks, and documentation after administration. By the end of emergency medical response, students are prepared with foundational knowledge, psychomotor skills, and professional behaviors that support success on EMR certification exams and entry into emergency medical services roles.